I'm Dr. Alicia Brennan, and I'm Medical Director of Children's Hospital of Philadelphia Pediatric Care at Penn Medicine Princeton Medical Center. I'm also board certified in pediatrics and in pediatric hospital medicine. This fall, we have seen an unusual uptick in respiratory viruses among children. Many of these viruses have been seen in other years, but this year the number of children affected and the severity of symptoms have prompted an increased number of visits to both pediatricians' offices and to emergency rooms. Many of these visits are connected to either respiratory syncytial virus, also known as RSV, or enterovirus. These are two common viruses that, while often mild, can become serious, especially in young children and in children with asthma. Typical symptoms of RSV include runny nose, decrease in appetite, a cough which may progress to wheezing, thick nasal discharge, dehydration, and trouble breathing. Your child won't necessarily have a fever with RSV, and infants younger than 6 months may just show signs of irritability and fatigue and may not be eating well. In the early stages of a respiratory virus like RSV, gentle suctioning of the nose is recommended to clear the nostrils. Cough and cold medicines aren't recommended because they may cause side effects and they are typically not effective in young children. If your child has a history of asthma, you may want to start using albuterol at home to see if it helps keep your child's breathing much more comfortable. If your child is starting to have difficulty breathing and the albuterol is not helping, you should call your pediatrician to have them seen or bring them to the ER. A visit to the emergency room is only recommended if your child has a fever, which we consider a temperature over 100.5 that lasts longer than 3 to 5 days, or a fever that occurs with other serious symptoms such as dehydration, trouble breathing, or seizures.